I can say to the honourable member that we are challenged within the department with respect to being able to respond to issues that come forward on a daily basis, and there are indeed many issues that come forward on a daily basis. But also, it's necessary for us to try and ensure that Nova Scotians have the very best information available relative to the workings of the department and the issues that are being addressed by the department as we conduct our business on a day-to-day basis.
Member from
Thank you, Mr. Chair. I understand what the minister is saying about needing communications people, but I find it a little hard to believe that a department, and the Department of Health and the various programs that are under it, who are scrutinizing every dollar, I would hope, that's spent in their department, and asking Nova Scotians to understand things such as wait lists, and asking Nova Scotians to understand that from time to time we have to close emergency rooms, from time to time there will be doctor shortages, from time to time there will be nurse shortages, there will be technician shortages, but how do you understand a 90% increase, since 1999 in a department? And it wasn't me who made the statement. I didn't make the statement that we need more spin doctors than doctors. As a matter of fact, spin doctors is a rather derogatory term, for people who work in public relations. I didn't say that statement. It was a guy who was running for premier in 1999 who made that very statement. So how can you justify in a department that you're looking at possibilities of whatever has to be done to try and save important health care dollars that flow into this province and that come from this province, how can you possibly justify an increase of over 90%? And what are you going to do when you increase another $170,000 or $77,000? Just how many communications officers does it take to try and put a positive spin on the fact that the healthcare system is in trouble in Nova Scotia, Mr. Minister?
the Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I want to welcome you to the chair. In terms of the increase, the variance between the estimate 0405 and 0506, we have a transfer of program administrative officer 2 position from the IT services, and that relates to the increasing role of information technology in healthcare, and again relates to the importance of everyone involved in the delivery of healthcare having appropriate information available to them. There's the professional services due to 3 additional communications officers position, and one of those is the Senior Citizen Secretariat communications officer who was employed between the Department of Health and the Senior Citizen Secretariat. And there is also a wage increase of 2.9% in that figure, and pay for performance as well as other natural increases that would occur. There is anyway, those are the main items that constitute the increase with respect to this year. And I can assure the members of the committee, Mr. Chair, that this department is probably one of the hardest working departments in health, or divisions in health. And part of the reason that they are taxed to the extent that they are is that there is a growing demand for information on the part of citizens with respect to the provision of health care. healthcare in the period of the past 5 to 6 years has become a national priority like it's never been before, and that has piqued the level of interest on the part of all citizens with respect to the provision of health care in a manner that we have not previously seen. And so as a result of that, you need to be able to respond with the provision of information and provide citizens with the best information you can. You also need to be prepared to provide the kind of technical background related to some of the complicated issues surrounding health. And I could just point to one recent experience we had with the CJD disease, one where it was extremely important that Nova Scotians understood the issue at hand, understood the fact that everything that should be done was being done with respect to the control of that situation, and that the confidence of Nova Scotians be maintained throughout with respect to our healthcare system. So the challenge of communications is very, very significant, and it does relate to the fact that healthcare has become the #1 issue right across the country, and it's as high here as it is in any other part of the country. And when there is that level of concern, it is appropriate to have the resources to be able to respond to citizens with the information they require.
The honourable member from Glace Bay.
Thank you, Mr. Chair. Let me change the subject here, if I could, please, and let me state to the minister, as I'm sure he does as an MLA, as a cabinet minister, probably on a daily basis. I know we do anyway, or I do. We hear daily how the program of home care seems to be failing to meet the needs of residents in this province, whether it be for disabled people in a self-managed care program, or a lack of home support services that result in clients having to be readmitted to hospitals. And we've heard of inconsistency in guidelines for home care. Mr. Chair, since 2001, 2002, the home care budget in this province has been underspent by over $15 million. In fact, since the government has come to power in 1999, we've only seen an increase of about 33% in estimate expenditures, and the actual expenditures since 1999 have only increased by 23.6%. So let me ask the minister a very simple question, Mr. Minister. Why is that?
The honourable Minister of Health.
Thank you, Mr. Chair, and thank the honourable member for that question. And the honourable member correctly puts his finger on a challenge that we have within the Department of Health relative to the provision of home care services. And very much it's related to a human resource issue and finding the appropriate resources to be able to provide this service. And it is one where we are placing our departmental resources to addressing. And I'm not in any way suggesting that we have rounded the corner completely, but we are, I believe, moving in the right direction. It is certainly a priority of the department to be able to enhance our capacity to deliver home care to the people of the province, because it is very much in our interest to increase that capacity. The longer that citizens can remain in their homes is obviously to the benefit of the citizen, and it is the desired objective that they remain there as long as they possibly can. But the added benefit for the healthcare system in the province is that as long as they are in their homes, then obviously it is a much more efficient use of the resources of the province. So it is a win-win both for the clients and for the healthcare system itself. And our objective is to address the resource issue and, as I indicated, a human resource issue to try and resolve this matter positively. And part of the province-wide consultation that is taking place undoubtedly will give us some recommendations relative to addressing this concern as well.
The honourable member from Glace Bay.
Thank you, Mr. Chair. The minister has indicated previously that, or the department has indicated that they'll invest $750,000, increasing the scope of home care services. So I'd like to ask the minister what new services will be provided with that $750,000, and where exactly will they be provided?
The Honourable Minister of Health.
Thank you, Mr. Chairman. There are really two objectives, and they're very, very similar. As I indicated in my answer to the previous question, our overall objective is to ensure that people spend less time in acute care than in any other facet of our care. So if we can increase our capacity to provide acute care services at home, then we have greatly reduced the cost of providing acute care, as well as providing the patients with a much more with a much greater level of satisfaction in terms of where they're receiving their care. They'd far sooner be at home than be in a hospital. And in my own area in Antigonish, we are pioneers with respect to the issue of providing home care, and it goes back to the Martha Home Care program, which was developed by the Sisters of St. Martha and has developed and grown and is now an integral part of the Guysborough Antigonish Strait Health Authority, GASHA, and their delivery model is now referred to as hospital in the home, and that is a program that works extremely well. So we want to see that expanded throughout the province, and this additional funding will assist in doing that, as well as providing other services in the home. So, Mr. Chairman, it is a desire on the part of the Department of Health and government to allow our citizens to receive as much care at home as they possibly can, both for the benefit of the patients involved, as well as for the benefit of freeing up acute care beds, so that those who need acute care services will be able to receive it in a more timely fashion.
The Honourable Member from Glace Bay.
Thank you, Mr. Chair. I think I will agree with the Minister on a couple of points. One, that certainly we expect a better home care program, which would better meet the needs of our residents, and it would provide, as the Minister has indicated, some much-needed support for our acute care sector. We also hear, Mr. Chair, we hear a great deal, again I do, from individuals who are on a home oxygen program, and they're seeking support for portable oxygen. So my question to the Minister has or is the Department considering coverage for portable oxygen? And if yes, then when will we see any coverage?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And that is a matter that I would appreciate if the honourable member would allow me to take his notice, and I'll get back to him with hopefully more detailed response than I can at the moment.
The honourable member from Glace Bay.
Thank you, Mr. Chair. I'd also like to bring to the minister's attention a letter that I have that is dated February 20th of this year. It was a letter that was sent to the minister by a Ms. Cheryl Gardner of Glace Bay. She was writing regarding the lung transplant program. She's currently a patient of the Toronto lung transplant program, and she was advised to write to the minister as provincial health minister, and that she's living and waiting for a transplant in Ontario, that she'll still remain a resident, of course, of Nova Scotia. Under the this is her letter. She says, under these circumstances, I am requesting a written statement to ensure that my home province will provide the appropriate medical coverage and other necessary coverage that I will need until I receive the transplant, plus coverage of the transplant and drugs while in hospital. And she highlighted a list of drugs that she takes in a letter, and also referred to the, it's called a microspirometer. How am I doing, Deputy Minister? Is that the correct term? For your perusal as well. If you require any further information, to contact Cheryl Gardner. I'm wondering if you can explain to me, as I understand it, the cost of drug costs are covered, living accommodations are not covered. Is that the case? And what is the difference between what Nova Scotia would offer to a lung transplant patient compared to other provinces, specifically Newfoundland? I understand Newfoundland does offer somewhat more than what Nova Scotia offers.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The services that Nova Scotia provides are consistent with the services that are provided by other provinces except Newfoundland, Labrador, and the Northwest, and the Territories, not just the Northwest Territories. Their distance challenges are considerable compared to ours, and as a result, they have had in place for quite some time assistance for travel within their jurisdictions, as well as assistance outside the jurisdiction for services. Again, what we provide in this province is consistent with what is provided in all of the other provinces in Canada.
The Honourable Member from Glace Bay.
There is, thank you, Mr. Chair, there is a little more, I think, offered by the province of Newfoundland, as I understand it, because in response to a letter that was sent to you from my colleague from the MLA for Victoria the Lakes back in December of last year, you outlined in the letter that currently Newfoundland is the only Atlantic province that has a medical transportation assistance program within the Department of Health, and that helps patients who have to travel out of province for services. Is that similar to what, does Nova Scotia offer that assistance as well?
The Honourable Minister of Health.
Thank you, Mr. Chairman. No, we do not provide a similar program.
The Honourable Member from Glace Bay.
Let me ask, thank you, Mr. Chair. Let me ask the Minister then, why wouldn't Nova Scotia offer to cover the medical transportation at least, and why it isn't covered? What's, in some cases, I would imagine that perhaps community services would be able to help out in some aspects with some individuals if they are clients, but if someone is not a client of the Department of Community Services, and in this case, I know at least in the person that I'm talking about, she has had to take a tremendous loss in terms of her work and has no assistance to be offered to her. So has it ever been considered, as this being looked at, that we could be helping people who are having to go to Toronto for lung transplant?
The Honourable Minister of Health.
Thank you, Mr. Chairman. And Mr. Chairman, there are other circumstances in addition to lung transplants where people from time to time require services that are not provided within the province. Indeed, that is it's a huge challenge for individuals who are facing that prospect. I have requested the department to provide me with some analysis of the costs that are involved with respect to addressing some of these situations. That process is not complete. However, I do know from the information that I've received initially that it is a very expensive prospect to consider.
The honourable member from Glace Bay.
Thank you, Mr. Chair. If I may then, and I'm not sure, and I'd mean to put the minister on the spot, but because he probably wouldn't recall with all of the correspondence that he would receive in the run of a year whether or not you've replied to this individual piece of correspondence. But if you could check perhaps with your staff and ensure that you have or will reply to the person in question, and that indeed the program is, at least you're taking a look at it and the possibility something there may exist or may not exist, but at least to reply to the person in question here that I've mentioned, and I will provide you with a copy of her letter at the end of my time, Mr. Chair, which I may inquire. How much time do I have left, please?
Your time goes till actually 6:30. At 6:28, at 5:28 you were to begin, but the minister was continuing to speak until 5:30, so the Liberal caucus time goes till 6:30.
Thank you very much, Mr. Chair. Let me shift gears here again and turn to the subject of acute care, Mr. Chair. Since 2000-2001, the acute care budget, DHA's, overspent by $140 million, according to our figures. Let me ask the minister, how many new programs have been introduced in the acute care program with that $140 million?
The Honourable Minister of Health.
Thank you, Mr. Chairman. I just want to be clear in the nature of the question. I assume the honourable member is referencing the accumulated deficits that occurred early in the formation of the district health authorities. And one of the things that we've been able to achieve is we've been able to move the district health authorities much closer to a balanced situation over the period of time, so that for the most part they are coming in with balanced budgets. Now, that's not to say that every year we don't have challenges in terms of working with them to get them to a balanced situation, and at times they're not totally successful in achieving that. We did take some initiatives with respect to value for money assessments over the period of the last couple of years. They have proven to be successful in giving both the district health authorities and the Department of Health some insights into the challenges faced by the district health authorities. But if we take even the situation we faced last year in terms of addressing wait times, or you can even go back 2 years ago when we were addressing some of the challenges faced by the district health authorities. We found that the rising costs of cancer drugs, for instance, was a real challenge for the district health authorities, and it became necessary for us to recognize that and have that money added to the base, so that in years following that, by having it added to the base, it would put them in a better position to be able to to meet those needs. So the real challenge for us has been to assist the district health authorities in reducing those deficits, and on the other hand, for us to be able to respond when we felt it was appropriate to provide them with additional funds. But in terms of the challenges that are faced by the district health authorities that relate to the growing costs that they face, there is a tremendous growth in the provision of dialysis services by the district health authorities, or by Capital District that provides services and satellite services around the province, and the Cape Breton District Health Authority. The growth in dialysis services is in excess of 10% a year, so that's a real challenge. We have increased cardiac care certainly in the Capital District. That has been provided, as well as elsewhere. We have put more resources into orthopedics. We have more work to do there. There has been additional funding provided for mental health services in the 03-04 budget, and obviously the member would know that we've added more money to that in this year. And there is the issue of addiction services. That's a challenge for the district health authorities, and the additional methadone clinics in Halifax and Cape Breton. That accounts for some of the increase. So there are two things that have happened over the time frame referenced by the honourable member. One is that we have been successful in working with the district health authorities to significantly decrease the amount of money that are in their deficits, so that they are more and more coming in with balanced budgets or nearly balanced budgets. And secondly, there have been the services that I've outlined that have been increased.
Honourable member from Glace Bay.
Thank you, Mr. Chair. The minister is skilled at making the minutes tick away on the clock, Mr. Chair. Remind me not to throw him another lob ball like that in the future, would you please? But which leaves me with a very limited time. So I would like to know, just on probably my last question on assisting low-income Nova Scotians with diabetes, Mr. Minister. The government has added $2.5 million for a low-income diabetic program, and it's a welcome investment. That the 2003 election made a commitment, I should remind you, of $3.2 million, just to remind you. But as my question, I'd like to know, why is the budget commitment $700,000 less than what was promised during that election campaign? And I'd also like to know, in the time remaining, when will families be able to apply, how they can apply, and what income thresholds will be put in place for that program?
The Honourable Minister of Health.
6 months.
Thank you very much, Mr. Chairman, and I apologize to the honourable member that I attempt to put too much detail into my responses. I'll endeavour to be selective in what I leave out, Mr. Chairman, in the future. But I certainly don't want to err on the side of accuracy or the level of information that's appropriate to provide to the committee. Having said that, Mr. Chairman, the honourable member does indeed point out to a difference in numbers that were committed in the I guess you're quoting the blueprint document and what we have in the budget. And as a result of the research that we did within the department right across the country, in looking at other jurisdictions that have implemented such a program, we were told by them that you will not get the level of uptake that you anticipate in the beginning with respect to those programs. And that was a consistent theme that we heard from every other jurisdiction that has a similar program in Canada. So based on that, we have a number less than the, what was it, 3.5? Yeah, less than the 3.5. But I will also say this to the honourable member, that the program we are implementing, when fully implemented, that is with 100% take-up of the program, and unfortunately we will not get 100% take-up, but we will do our best to move that to as high a number as we possibly can, that the program, when fully funded and implemented, will cost in excess of $8 million per annum. So we have not, in the long term, in any way backed away from our commitment. If anything, we have considerably enhanced that commitment relative to diabetic care for the province. So I'm just being showed figures here. If we have a potential of 6,750 eligible residents, and if there were a full take-up on that, that would be an amount of $9.286 million. So we can see that our commitment is very significant. We are in the process of putting together, in consultation with the Canadian Diabetes Association, the criteria related to the rollout of this program, and we should be in a position to start processing applications in the fall with respect to the delivery of assistance.
The honourable member from Dartmouth East. North. My apologies.
Thank you,
Replaced the honourable member from Dartmouth East. The honourable member from Dartmouth North.
Thank you, Mr. Chairman. And I want to thank the honourable member for Halifax Needham, the NDP Critic for Health, for giving me the opportunity to speak for a couple of minutes on a very important issue. Mr. Chairman, I want to go back to the issue relating to wait time. And I do know that there had been some extensive discussions on this from with the honourable member from Halifax Needham, as well as the minister in his response. The unfortunate part of it is that many of our constituencies, the people are calling us, do not understand or know why there is a need for wait times in this province. The province is a relatively small province in relation to population. We have a number of regional health centers, and many citizens think that it's unimaginable that one would have to wait the periods of time in which they need to wait in order to get into surgery. For example, on Sunday, I happened to be in my office simply because it is now budget estimates. And because of the time consumed in the legislature, I try to make it appropriate that I will be available to the constituents as much as possible. So sometimes that requires one's weekend time. And as a result of a Sunday call, I received a call from an individual constituent who was just so appalled about the wait time that this individual had to wait. The individual had been slated for surgery, I believe, in December, actual date, December the 4th. I don't want to mention names because I don't think it's appropriate to mention names in this legislature, but I do want you to know that this is one of many that I've received. And this individual had, in fact, had a previous surgery with respect to, I don't know if it's possible, but the individual had stated a total stomach removal, repairs to his esophagus, hiatal hernia, a whole bunch of individual operations, which in fact translated into him spending some time in hospital and some time at home. Infection had set in, and there was a need for nursing around this very important surgery that he had taken. There was also, that he had received. There was also a need for the individual in turn to go back to surgery and to have surgery rather quickly. The individual called his family practitioner, the doctor, and he also called his specialist. And what's far more alarming is that his specialist and his family doctor had indicated that he called his MLA. And I don't know, Mr. Chairman, to the minister, if in fact the citizens of my constituency think that I have a hotline to the minister, whom in fact on the red phone rings, that I can directly call the minister up and say that, look, this individual has been waiting for a long period of time, and that this individual should be in there having his surgery, in this particular case a male. So my question is to the minister. I've heard you say that in fact you're setting up a registry of time, a registry of client wait lists. There's a whole new process going through, and this takes some time. I guess at the end of the day, when do we finally see something that's going to be tangible so that the citizens of Nova Scotia can finally say that wait time is a time of the past?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The one thing I can say with certainty with respect to wait times, Mr. Chairman, is that we will always have wait times because regardless of how efficient we become, it's going to be necessary for people to wait in order to receive the services that they need. The real challenge is to get wait times that are appropriate and fit with medical standards and fit with time frames that are appropriate relative to the individuals and the diseases that they are faced with. And we've made some real progress in this province with respect to cardiac wait times. And we're now at or below the national standard with respect to cardiac wait times. We've made real progress with respect to oncology wait times. In most areas we're reasonable. There are some areas from time to time where the wait time gets a bit longer than we would like to see it. We have some challenges that we discussed earlier. We have a real challenge in terms of the pain clinic, for instance, and being able to provide appropriate funding to that. And I don't believe I had an opportunity in response to a previous question from the honourable member's colleague from Halifax Needham that while we're providing $300,000 for that clinic this year, it's our estimate that we could significantly address that wait time with respect to the pain clinic with about $1 million. And officials tell me that with that amount of money that we could get that pain clinic wait time down to an appropriate level. So the $300,000 that we're providing this year is simply a beginning with respect to that, and our objective is to bring that down to a reasonable level. Our real challenge is in the area of orthopedic surgery, right across the piece, and there are a number of things that need to be accomplished with respect to meeting that objective. The work of the wait times monitoring project and the work of the committee will help us better understand the challenges with respect to those wait times. But that in and of itself is not going to get us to reduced wait times. The question of being able to do that is to, first of all, ensure that we are doing the level of recruitment that we have to do to have the medical personnel in place to provide the services, whether that be anesthetists or whether it be surgeons or whether it be nurses that are required to provide the service, or whether it be physiotherapy that's needed to provide the service afterwards to get people back on their feet following those surgeries. That's all part of the challenge. We also need to ensure that the beds that are required, the acute care beds that are required to care for citizens following surgery, are in place, and that's not unrelated to our initiative with respect to home care and ensuring that we are treating people in their homes for as long as possible so that we can move them away from the acute care sector, freeing up those beds. Or whether it is in the provision of additional long-term care beds. We've referenced the need for those in the budget. We spoke about the additional long-term care beds that have been provided in the Valley and in Capital District. We spoke about what's the new name for the 50 beds, the convalescent beds that we're going to commit. There's $1.6 million provided to that. The objective there is to move people from the acute care sector into these convalescent beds so that they can, once their acute care is completed, then the restorative care, that's the term we're looking for, restorative care beds, the restorative care can take place, and then these individuals can be treated appropriately in beds of that nature. So it's a whole host of challenges that face us. Information is a very integral part of that, and that is being addressed by the work of the Wait Times Monitoring Project and the Wait Times Committee. But they are also going to help us in terms of being specific about our recruitment needs, being specific about where we need additional acute care capacity to be able to meet these needs and to assist us in the whole realm of human resources that are required. I hope, Mr. Chairman, my remarks weren't unnecessarily long and that I tried to be as comprehensive as I could. Thank you.
There's a new questioner, so I'm not sure what his sentiment would be. The honourable member from Dartmouth North.
Thank you, Mr. Chair. And I don't mind your comments with respect to being informative. The important thing is, and detailed, I want to make sure that I have the appropriate information to go back to my constituents with. However, the most important thing here, Mr. Chairman, is that through you to the Minister of Health, is that many citizens don't understand the complexity of the bureaucracy and how complex that bureaucracy is when delivering a service to them. They're primarily interested in having made sure that the service is available to them today. And I guess on that same track, Mr. Chairman, through you to the Minister of Health, is that I've heard some discussion around private hospitals. And something new to me, and I must admit that I was somewhat unaware and don't know if this is actually correct or not, but I do believe that there are private medical organizations who use public facilities to carry out private medical practices, such as maybe cosmetic surgery, plastic surgery, and the like. And if in fact they use public facilities like the QE2, like the Dartmouth General Hospital or any other hospital within the health service, is that in fact extracting from time which other surgeries would normally fall into place? And if in fact it doesn't, can you explain to me why it doesn't? And secondly, do you in fact make the revenue off of providing public facilities or charging fees to private specialists for public facilities, and is that economically feasible or financially feasible should be the approach?
The Honourable Minister of Health.
Yeah. Thank you very much, Mr. Chairman. And the issue raised by the honourable member is indeed an issue that Nova Scotians would want to understand, and I appreciate his question in that regard. First of all, let me make it clear that the topic of discussion in recent days about a so-called private hospital in this province is the facility in question is not a hospital. It doesn't look like a hospital, but it does look like an oral surgeon's for dental services facility, and it does have within it, or is designed to have within it, the capacity to be able to do elective, non-insured surgeries. So that is what that facility is about, and that's what the intent is with respect to that facility. Now, the honourable member references the fact that many of these services are today conducted in facilities that are publicly funded, i.e. our hospitals within the province. And I can assure the honourable member that those surgeries are conducted at a time when the ORs are not booked for normal everyday operations. Some of them occur late at night or occur on days when doctors are otherwise engaged with respect to meeting the needs of their patients, that is through consultation or in some other way. So the administration of the Capital District Health Authority, for instance, does take great care, as with the IWK, to ensure that these elective non-insured procedures take place at a time that does not interfere with the need for the publicly funded, insured elective and emergency services that are required for patients covered under the terms of the Canada Health Act.
The honourable member from Dartmouth North.
Thank you, Mr. Chairman, and I want to thank the Honourable Minister, but that's all and well and good, but those who are out there viewing these proceedings tonight, the health budget estimates, would want to know that if there is this time available, and even though there are medical specialists who have other practices and maybe practicing that out in their offices and so on, is there not the potential to utilize more of the time available in the ORs to speed up the process of or reducing the wait times?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And the honourable member indeed raises a question that may not be clear in the minds of citizens. The fact is that the times in which these OR facilities are made available for these non-insured elective procedures are times when the resources required to provide the insured services, whether they be elective or emergency, are not employed or scheduled for those purposes. And the resources are not available in terms of scheduling them for those particular services at that time. So there isn't, what the honourable member is, in order to achieve what the honourable member is suggesting, we would have to have the people working around the clock in order to achieve that, and that's simply not possible. And we are operating in an environment where we are challenged with respect to the number of anesthetists that are available to us in this province. Our alternate funding program is helping us with respect to that recruitment issue, but it is still a challenge, and that has been the subject of discussion in previous days of this session.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman, and I anticipated the Minister's comment or response. Minister, however, I asked earlier, since the private medical practice does not have to provide the facilities, do not have to build their own infrastructure, their own buildings, to bring in their own equipment, and the technology that's needed to provide the services to Nova Scotians, all that is in the public facility. Are we, as taxpayers, receiving the value of dollars for the usage of the equipment and/or the facilities, and the facilities, not and/or, and the facilities? and are Nova Scotians getting a return on the use of those private facilities?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman, and I apologize to the honourable member. I realized he asked that question in the first question, and I didn't. I answered a number of other questions, but it was simply an oversight that I didn't get to that. The district health authorities determine what the charge will be to the medical professionals who are providing the non-insured elective procedures, and I can't give you a precise number with respect to how much they charge, but I will undertake to do a survey with the district health authorities and see what they are charging, and indeed we'll take a good look at that and satisfy ourselves that it is an appropriate amount in each and every circumstance.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman, and also to the Honourable Minister that he will make sure that it's a fair charge in relation to charges across the country. I do know that you had mentioned in the Honourable Member for Glace Bay had mentioned with respect to portable oxygens and the Department of Health supplying portable oxygens, the oxygen tanks to those Nova Scotians, oxygen supplies, I should say, to those Nova Scotians who are unable to afford it. And the minister did indicate that he would get back to the Honourable Member of Glace Bay as to where the department is with respect to this issue. I hope that I can take it that the minister will get back to all members of the legislature with respect to this issue.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And when we provide information such as the undertaking I took with the Honourable Member for Glace Bay, our procedure is to provide the information, supply the member with that information, but also to file it with the clerk. And the intent of filing it with the clerk is to make sure that it is available to all members of the House. So the answer to his question is yes, we will undertake to make sure the information is shared with all honourable members of the House, and that is the procedure that we will use. I want to go back to a previous question, and I may not have made it clear with respect to the answer. When the district health authorities charge for the use of their facilities, it's not just for the use of the facilities, but all staff that are employed are not paid by the public funds. They're paid for by the clinics that are providing this non-insured elective service to individuals. So all staff, all supplies, and the time charged for the use of the facility are all charged out to the people that are providing that service, and they, of course, collect it from the individuals who are paying for the service. Now, what's the amount of money that's provided to the professionals is a standard fee, and it's set and everything else. What's appropriate for us to find out is whether we feel the amount being charged for the use of the facilities is an appropriate amount.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman. Mr. Chairman, I want to move on now to self-managed attendant care. And I do want to say for a number of years I've stood in this legislature and asked the ministers of health with respect to expanding on the project of self-managed attendant care. And I do want to say that the honourable members from the third party have also brought this issue forward and in a more vigorous manner as most recently. But I want to say that I'm pleased to see that there's some, I believe, $500,000 that's allocated to the self-managed attended care program. My question to the minister is how did you arrive at the number of some $500,000? And secondly, how many individuals who are in need of self-managed attendant care are going to be the recipients of these dollars that are now meted out, that will be meted out?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. The number that we have used is very much a number that's intended to get us started in terms of providing this service in this fiscal year. We recognize that self-managed or self-directed home care will be an integral part of the home care service that will be provided to individuals within Nova Scotia. The other thing that is happening in this province is the province-wide consultation that is taking place with respect to the entire issue of continuing care. And that is looking at the models of home care that are available or could be available. It is looking at the potential demand for that type of home care relative to each of the models that might be considered. It is looking at the issue of what is the relative, or what is the appropriate, I should say, number of beds for long-term care in each area of the province. Now, in the interim, we recognize with respect to the issue of long-term care beds that we know that by providing an additional 100 beds in Cape Breton and an additional 125 to 150 beds in the metro area, that we are not meeting the demand fully by doing that, but we are making a start. In the same way, by providing the $500,000 with respect to the self-care or self-managed home care, we will not meet the full demand relative to the provision of that service, but it will start us in that direction and will be guided by the results of the consultation that are taking place to assist us in where we should move in the future relative to the funding levels and to the variety of home care and type of home care that we should be providing. So I view it very much as an interim step with respect to a longer objective and a bigger objective relative to the whole question of home care, whether it be the traditional home care or whether it be self-directed home care or some other model of home care.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman. And I guess my question is I didn't get clearly as to how you arrived at the number of $500,000 to provide. I guess it's a step, and I guess this was the initial step to start the self-managed attendant care program beyond the pilot project of some 10. I guess my other question is do we know, or will this come out of the consultation across the province, or do we already know how many Nova Scotians would benefit from a self-managed attendant care program?
The Honourable Minister of Health.
Thank you, Mr. Chairman. As I indicated earlier, one of the pieces of information that we hope to get from the province-wide consultation is a more accurate number with respect to the number of Nova Scotians that can benefit from a self-directed home care program, and that is what we want to get. Now, the number that we have put in the budget, as I indicated, is an interim number. We are guided in terms of that number by the information we received from the Independent Living Resource Center, who have experience with that, and they estimate that it's approximately $30,800 per annum per individual, and that's an average because some require more, some require less. You know, we're obviously going to start meeting some of that demand. I'm not pretending in the least that we're going to fully meet it, but we will be on the way to doing that. And it is a transition in terms of going from the pilot to the full-fledged program that is involved. Yeah, I'm reminded by my deputy, Mr. Chairman, that one of the things we need to do with respect to the consultation process is to do an analysis of individuals who are in long-term care facilities to see whether the long-term care facility is indeed the most appropriate setting for those individuals, or whether they might be more appropriately cared for at home through a form of self-directed home care. And that's some of the information, or the type of information that we want to get as a result of this consultation. So it is very much a work in progress, and I hope that this time next year we'll have far better detail in terms of the numbers of clients that the numbers of clients that need the service, and our capacity to be able to meet that particular demand.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman. And I don't want to speculate on numbers, but I've heard some numbers battered around of some 60. I'm not sure that those are the numbers, so I appreciate the minister at least waiting for some of the consultation to come forward, so that we have a clear picture as to what's happening out there, and that hopefully in future budgets we will see increases to meet the needs of all of those Nova Scotians who would prefer the self-managed attendant care program, all those disabled Nova Scotians. Another issue that was dear to my heart, and I brought it up on through a number of budget debates, was the issue around technical aids. And as a matter of fact, I brought it up last year with respect to the minister. And the minister did indicate that this was a matter of resources. We now have a budget that has seen millions of dollars come down from the federal government. We do see an agreement with respect to the offshore and that money going towards paying down the debt, which will save an additional $50 million, which can very well go into health as well as a number of other departments. And when I talk about technical aids, I'm talking about wheelchairs, prostheses, talking about crutches, a number of different apparatuses that will be required to make the person mobile. And that's something that I've continuously brought forward to this to the Minister of Health, simply because I find it extremely difficult to stand here in this legislature as a disabled person and watching disabled people who want wheelchairs go out cap in hand and receive some funding, with the exception of the child wheelchair program that was introduced last year. But individual adults who need wheelchairs, each specially modified to those individuals, each an identifiable cost, and they having to go out to service organizations and agencies to assist in the cost sharing of the funding. Now, some of that comes through community services, but I would say to the Minister of Health, I don't understand why this can't be a medical service insured issue, the same as any other application and needs of citizens. So I think that even, Minister, if you were not to put in the total dollars that would be needed, at least we could have set aside a pilot project, of technical aids managed by disabled persons. And I think that would have been the best of both worlds. So I'm wondering if the minister has actually, and I believe that this was a recommendation by the Nova Scotia League of Equal Opportunities as well, Leo, as an acronym. And I believe that the minister has had ample opportunity to look at this through a health budget window and see what can possibly be done.
The Honourable Minister of Health.
Thank you, Mr. Chairman. Mr. Chairman, the issue raised by the honourable member is indeed an appropriate issue, and is one that we are attempting to address in the budget. We're looking at yes, we have allocated in this budget an amount of $963,000 for a loan program for equipment, and we're doing this in consultation with the Canadian Red Cross. So it's you know, that the equipment described by the honourable member would be available for loan purposes, and that allows us to ensure that the pool of equipment will remain intact, because we'll have the proper administration and the proper capacity to be able to maintain that equipment and keep it in good working order. So we indeed share the concern of the honourable member. Our approach is not precisely as the honourable member suggested it should be, but I believe it is one that will go a long way to addressing the concerns raised this evening.
Would the honourable member from Dartmouth North allow an introduction? The honourable member from Cumberland North, Colchester North.
That's better.
I'll get it soon. I'll get it straight soon enough.
Thank you very much, Mr. Chair, and I also want to thank the member opposite for allowing this introduction, taking up some of his time. Before I do the introduction, I know as a former 30-year police officer and in Truro and elsewhere, serving many detachments and transporting a lot of prisoners in my time before we had a sheriff's department. And I'd like to introduce the members of the Nova Scotia Sheriff's Department, deputy sheriffs. And I'll start with the Halifax Regional Area, and I'd ask that you stand as I call your name. Jason Elliott, Tammy Robertson, Greg McRae, Daniel Ray, Jason Bowden, Kimberly Northrop, Earl LeBlanc, Mike Ross, and Blaine Tolan. And from the Truro Sheriff's Services, we have John Jarvo and Ray Lindsay. From the Amherst Sheriff's Department, we have Brian Haynes. In New Glasgow, we have Ann Greeley and Bob Green. And I thank you very much for attending this evening. I don't know if I forgot anybody that's on the list, I apologize. I know that you've come a long way, and right now I want to thank you all for coming and for the service that you provide the people of Nova Scotia. Thank you very much.
Members of the House extend a warm welcome, and we hope that you enjoy the proceedings. The honourable member from Dartmouth North.
Thank you, Mr. Chairman, and I too want to extend a warm welcome to representatives of the Sheriff's Department who are here tonight listening to budget estimates. And they can certainly set in on the details, how minute they may be at times, with respect to how their tax dollars are being spent. And I also would like to let them know, Mr. Chairman, that we as opposition members have the opportunity at this time to question the government on the budget they have presented to Nova Scotians. And we do that quite frequently. I want to go back to the technical aids, and I do know that, Minister, and I do apologize because I did know that you had allocated some $900,000 towards the Red Cross to administer a program. However, you know, one size does not fit all when it comes to individuals who need wheelchairs. There's specially designed mobility apparatuses that in fact individuals need in order to make themselves accessible. I should say make it accessible for them to move around this environment. And I guess, Mr. Chairman, my question to the minister is, although, and the Red Cross does an excellent job in providing the service, although this is over and above the services that the Red Cross would provide, it does not stop these individuals from going to have cap in hand to agencies and organizations out there in the community to partially assist in the funding of their electronic wheelchairs or their wheelchairs custom made to benefit them, because after all, it's nothing more uncomfortable than having to spend time in a wheelchair the majority of the hours of your day. So I guess my question is I do know that last year the minister had indicated that he introduced a children's wheelchair program. I'm wondering, when will Nova Scotians who are disabled and who need the assistance of a wheelchair to improve their mobility will see the day that they don't have to go cap in hand to agencies and organizations to receive what I consider to be a service that should be funded under the MSI, or the Medical Services Insurance?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And what I did not indicate in my response to the earlier question is that the issue of technical aids is something that is not covered under the provisions of the Canada Health Act. So I have to deal with the facts that I have in front of me, and so it is not an insured service. Now, having said that, we recognize that there is a need, and I want to clarify what the $963,000 is a pool of money that is provided to purchase a supply. So it's like a capital fund to go out and purchase these technical aids and to make them available. But there is also funding available to respond to specific needs in certain circumstances. So there is a recognition that the honourable member says one size does not fit all, and there are times when there are unique requirements that need to be considered and responded to. So our efforts will be focused in that direction of trying to first of all ensure that there is a supply of technical aids out there to assist persons with disabilities, but also that there will be some funds set aside with respect to responding to special needs that may arise from time to time. And I'm sure that through our experience in the coming year, we will learn a great deal about the appropriateness of the amount of money that's set aside for those purposes, and whether or not we need to adjust that amount in order to meet the special needs identified by the honourable member.
The Honourable Member from Dartmouth North.
Thank you, Mr. Chairman. And I suspect the minister and his department will inform those agencies, the agencies whom in fact are connected to the disabled community, and inform them of a process whereby they can access the kind of funds needed and the kind of services available to them through the Department of Health. I do know that the Senior Secretariat falls under the Department of Health, although I see it under what's called the Public Service as well, and I guess, I don't know where this stands, but I guess it still comes to the Department of Health, but it's a public service that's provided through the Department of Health. Is that the case? Because when I look at the budget book and I see where it says Senior Secretariat, it shows that there's nothing allocated for this year, and then I go to the Public Service and it shows that it is in fact allocated, and there's an additional some $200,000 additional added to the Senior Secretariat budget. I want to talk just briefly because my time is running out, and I'm hoping that I will have sufficient time to talk around this, because it was very important that the Senior Secretariat had taken on a responsibility in conjunction with the Nova Scotia Legions to provide a forum on aging in this province, and that in fact that they had gone out across the province seeking opinions from seniors on issues that they have that they believe existed out there, and they wanted to know if in fact they were hearing the seniors correctly on these issues across the province. And as you and I both know, that right now there is some 125,000 seniors in this province, I believe, as of the 2001 census. I believe within the next 20 years, that's going to reach 250,000 of our population. And if in fact that is true, I want to know, and this is, and I want to say to the Senior Secretariat that they have done an admirable job in going out there, as well as the Legion, for providing the facilities in order for the public to come forward. My concern is that less than 1% of the seniors' population actually came out to those forums. Now, my concern is are we going to get the kind of information that will develop a comprehensive report that will be offered in the fall of this year, 2005, with respect to the issues facing seniors? Now, the Senior Secretariat has and is inviting input into that, I guess, and right to this very day there can be input provided with respect to organizations, seniors organizations out there. And I do know that we have a group of 9 who advises the Senior Secretariat as well. However, I'm just wondering if in fact we are reaching the population of seniors that we should be reaching. Those seniors who do not come out to the meetings and who are in real need of assistance through health, home care, long-term care, drugs, all that myriad of issues that relate to making sure that our aging population is going to be a healthy population in the future. And I guess I would, through you, Mr. Chairman, to the Minister, ask the Minister to comment on whether he's confident that we will get the kind of information that will guide us for the next 25 years.
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And I'm, as the Honourable Member correctly indicated, if I go back just to something else on technical aids, just to give a more complete picture, within our long-term care facilities, we have an annual budget of $6 million plus for technical aids within the long-term care facilities, in addition to the money that we're making available to the Red Cross this year for the purchase of the loan equipment. So I didn't want people to think that the $963,000 was the only amount of money that was being provided for that. The honourable member quite correctly raises the question of our capacity to be able to communicate effectively with the needs of senior citizens throughout the province, and our capacity to engage senior citizens. There is one characteristic about the senior citizen today that is changing considerably as their numbers increase, and that is that their capacity and their inclination to be heard is changing, and it's changing positively in the sense that the senior citizen of today is not shy about making known their concerns about their issues. And many of them, thankfully, are motivated to become involved in the process of attempting to represent the views of senior citizens in that regard. And I'm reminded, Mr. Chairman, of the late Curtis DeCoste, a resident of Boylston in Guysborough County, who hailed originally from Harbour Bushy. I first got to know Curtis when he was the league statistician for the Rural Hockey League in Antigonish, the oldest continuous operating senior hockey league of its kind in the country. That's the claim they make, and nobody has ever come forward to refute that claim. I do know that it goes back well into the 1930s, and Curtis DeCoste played a very important role in the operation of that hockey league. But he went on after his retirement to become very involved in representing the issues of seniors throughout this province. And Curtis is representative of a growing number of individuals who are seeing it as part of their responsibility to articulate on behalf of the senior citizen population of Nova Scotia and indeed Canada. I had the privilege today of meeting with the president of the Federal Superannuates Association of Canada. That is a group that represents retired federal public servants, retired military personnel, retired RCMP personnel right across the country. And they have, I believe, somewhere in the vicinity of 170,000 members. They have a large representation in this province. With Mr. Jackson today, who was the national president for the Federal Superannuation Association, was Paul Cadeau and Ken Brown. And I've known Ken Brown for some time, since I became involved with as a member of the Senior Citizens Secretariat from my time as Minister of Education and as Minister of Service, Nova Scotia Municipal Relations. And he, of course, along with other members of the Group of Nine, play a very effective role in advocating on behalf of seniors. I would point out one additional feature of the consultation that took place by the Senior Citizens Secretariat last fall, is that they are an integral part of the province-wide consultation that's taking place with respect to continuing care that is being carried out by my department currently. And that we're very much appreciative of the spade work that was done by the Senior Citizens Secretariat, and we're piggybacking on that spade work with respect to the consultation that is currently underway. Now, I see the member getting anxious. I don't know if he wants me to sit down because he's another question, or whether he's prepared to accept just a bit more information on this. But the reason I mentioned Mr. Jackson today is because he made the point very clearly that seniors are much more articulate about their concerns today than they have been previously. But that's not to in any way diminish the concern of the honourable member with respect to our capacity to be able to get out there and do as wide a consultation as possible. That is a challenge. We work very hard at trying to meet that challenge, and we will continue to do so. For instance, one of the things we know is that more and more seniors are now using the web, and with that, they're getting more and more information. So the honourable member does raise a concern that I share. However, I am satisfied that the Senior Citizens Secretariat, as well as the Department of Continuing Care and its consultations, are making every effort that they can to get as wide a consultation as possible.
The honourable member from Dartmouth North.
Thank you, Mr. Chairman, and I do want to mention a couple of names in which the Honourable Minister had mentioned, particularly Mr. Ken Brown, who served on the Community Health Board and in the community of Dartmouth, just across the harbour here. And I did have the fortunate opportunity to meet Mr. Curtis DeCoste earlier when I first got elected here in 1998. And I do want to tell you that many individuals who speak on behalf of senior citizens and organizations, in fact, are extremely articulate. They are well informed. And many individual seniors are extremely articulate and well-informed and use the web to communicate right across this province and across this nation, as well as internationally on services that are being provided to seniors. However, there is a community of seniors in this province who do not have access to computers, have access to information, whom in fact do not have access to campsites or are unable to get to campsites that might be in their local libraries and so on. And those individual seniors are the ones who tell me that they may not be being heard. And I have said to them that there's some excellent work going on here with respect to the Senior Secretariat, with respect to the Group of Nine, with respect to the Nova Scotia Senior Citizens Federation or Association. All those agencies and organizations aside, there are some individuals who still feel that somehow they don't want to be looked over when it comes to preparing a report for the next 20 years as a result of what is compiled now and brings forward to the minister and will be brought forward to the minister in the fall of this year.
I'm not sure if there was a question at the end.
Absolutely. I do apologize. So I would ask the minister to respond. Is he sure that all seniors will be heard through this process?
The Honourable Minister of Health.
Mr. Chairman, I would very much like to be able to respond affirmatively to the question of the honourable member, but I think the honourable member knows that for me to give such an assurance would not be appropriate, because indeed, as hard as we will try, we will not be able to get the attention of every single senior. I would hope that all honourable members, if they don't have the necessary information in terms of how to communicate with the Senior Citizens Secretariat or with the Department of Continuing Care in the Department of Health, that if you would ask of us, we will make sure that we get that information available to you. I think all of us play a role to try to ensure that as many citizens as possible are consulted in this regard. And it is not just senior citizens that we need to hear from. Indeed, many who are not in the category of seniors probably have a pool of knowledge that would be very helpful to us as a result of experiences they have in working with seniors or living with seniors, or simply their relationship with the senior population. We need to hear from them as well. Indeed, all of us aspire to spending as much time as being senior citizens as we spend working. So that's the hope of all of us, and whether we succeed in that regard or not is going to be decided by somebody else. But you know, all of us have certainly thoughts about the needs of seniors, and all of us have a role to play in attempting to communicate that. So, Mr. Chairman, I'm not going to respond in the affirmative to the honourable member. No, I cannot guarantee that every person who should be consulted will in fact be consulted. Are we making the effort to ensure that as many people as possible are consulted? The answer is yes, we're making that effort and working very hard at it.
Honourable member from Dartmouth North with 2.5 minutes.
Thank you, Mr. Chairman, and to the minister, I would say I simply brought that up simply because of the poor attendance, and you know, and the less expression of thought by a number of seniors at those forums. So I'm just wanting to say to you, Minister, that hopefully the Senior Secretariat will be communicating the views of many of the seniors, or the majority of the seniors in this province, when bringing forward recommendations to your office. I do know that I have only a minute left, and I just want to ask you if you have given some thought, or maybe you have already done, and I'm not sure. Remember, there was a fine for people who opted out of home care services or didn't call or chose not to cancel their home care service with respect to a 24-hour notice. And I do know that there was a $50 fine to those individuals whom in fact did not cancel out at the appropriate time or did not give notification. I'm wondering if the minister and his department had looked at canceling that out completely, or if in fact it has proven to be beneficial in any way, and if it hasn't, then have you considered canceling that $50 fine that was initiated some 2 years ago?
The Honourable Minister of Health.
Thank you, Mr. Chairman. The honourable member, I know, was quite concerned about this initiative last year when it was brought forward. I want to, if I might, comment first of all on how it is employed. If I could back up just a little bit, we're in a situation where we have resources that are very scarce in terms of providing those services. So it's important that that the time of individuals who are providing those services are employed constructively and positively every day. The number of cancellations that occurred at the last minute or appointments that were not kept was rather high, and it was a concern that those services that could have been provided in that time frame were not being provided because the appointments were not met. We did not undertake to, callously apply that policy. We have a system whereby, first of all, when an individual misses an appointment, the individuals are contacted and told about the policy. They're informed about the policy. The second time in the course of a year, when an appointment is missed, they receive written notification of the policy and an indication that if there is a third infraction, then the fee would be applied. And that, Mr. Chairman, appears to me to be, to be a rather fair application of the policy. The policy has only been in effect for a year, but to date, I'm told that it is improving the level of communication with respect to appointments that are unable to be kept, and there is a better flow of communication back and forth, and the number of incidents of missed appointments is decreasing as a result. But as I say, it's only been in effect for a year. I would want to have a longer period of time before I were to give a definitive evaluation of the policy.
Thank you, Minister. I recognize the honourable member for Kings West.
Thank you, Mr. Speaker. Pleased to have an opportunity to ask a few questions, perhaps more specific to District Health Authority number 3. And I think my colleague from Annapolis has already talked about the doctor shortage in our area. And certainly not a lot has really changed for us in that regard over the last 2 years. And we have several hundred families just in the Kingston-Greenwood area alone who depend on trips to the emergency room or to outpatients at Soldiers Memorial because they don't have a family doctor. And I'm wondering if places such as Kingston-Greenwood, which has a very mobile population and a growing population of seniors, it's becoming a very key retirement area, and wondering if this area is being targeted by recruitment to look at the needs, and especially the present complement of our doctors are moving into that period where they are certainly moving to semi-retirement, and it's a growing concern. It's one that I would put at the top of my list I know from reading a little bit of the current literature, not necessarily the detailed reports, but certainly everything is indicating that an investment in a GP for a province or for any jurisdiction in fact has greater long-term benefits than investment in specialists. And certainly now we have many people in our area who no longer have that continuum for several years of family records at a doctor's office, regular checkups, and so on. It's basically the outpatient department that has become the mainstay of health for many people in our area. And so I would like for the Minister to make some comments in regards to recruitment, and in particular to looking at the shortage in the western area of Kings County.
Thank you. The Honourable Minister of Health.
There are people with the last year and a half to look at officials from planning.
Thank you, Mr. Chairman, and I want to thank the honourable member for his questions. And the issue of recruitment and retention is one that is a challenge for all of us. And while I appreciate the honourable member's concern for the area he represents and the surrounding communities, from a provincial perspective, and I feel it appropriate for me to put this in context, we are doing reasonably well in terms of the number of family physicians that we have. 96% of Nova Scotians have a family doctor that they were able to go to. Now, so that means there's about 4% of the population that don't. And the situation described by the honourable member is one where when you do have a transient population and you do have an area of the province that is attracting a retirement type community, then there are specific challenges in that area. Our physician policy with respect to the provincial physician resource plan that we have in the province is doing a lot of pinpointing work so that we do have a good handle on areas of concern with respect to the number of additional physicians that are required in those areas. The honourable member made reference, and it reminded me of a question I posed to representatives of Doctors Nova Scotia and to the College of Physicians and Surgeons recently. I said, with the diminishing number of family physicians and the increasing number of specialists, I said, is anybody concerned that there won't be enough general practitioners to refer the individuals to the specialists? So it does point to the need for us to find a way of making the general practice something more attractive to physicians than appears to be the case currently. We could certainly have more of the doctors that we're graduating focused on the provision of family service than is currently the case. However, I say that within the context of a province where we have 96% of our citizens who say that they have the services of a regular family physician. We try to work very closely with the district health authorities in terms of supplementing their recruitment efforts, and that is the sense of how I would describe it, because they really, in the final analysis, need to sell the individuals that this is an appropriate place to settle and to work. And what we want to focus on is ensuring, for instance, the steps we're taking in the Valley to provide the additional acute care beds, the 22 acute care beds, and that will help that area to become attractive to family physicians, knowing that they have that capacity in terms of the area. I'm told that Dalhousie is one of the highest number of students choosing family medicine, but that has been decreasing across the country. The federal, provincial, territorial work on this issue is currently taking place. We're working with other jurisdictions in that regard. And I do know that this particular issue is an issue that is of concern to my colleague, the minister responsible for immigration, because we have in this province a large number of foreign-trained medical professionals who are not able to practice. The case up till now has been a rather cumbersome one for them through the province of Manitoba in terms of receiving their accreditation. And I do know that that is something the honourable member or the Minister of Immigration is working on as well as myself, and the Doctors Nova Scotia and the College of Physicians and Surgeons. So that's not providing any solace to the honourable member immediately. I do believe that in the long run we will be in a position to provide more resources, but it's not something that you can snap your finger and make occur. Suffice to say, there is a real recognition of the problem. There is a recognition that there is a resource available to us in the province. We don't have to go outside Canada to recruit individuals. They're available in the province. We need to find a way of making them available to us so that they can provide their services.
Thank you, Minister. The honourable member for Kings West.
Thank you very much, Mr. Chair. A couple of the comments that you made there in your overview to my question, and I certainly appreciate the fact that the Valley Regional is going to get some additional beds, as you pointed out, in which I spoke positively to the local media in one of my reaction statements to the budget. Certainly very pleased to see that. And last year, the remainder of the 31 long-term care beds were opened up at Grandview Manor. However, very quickly, we were once again faced with too many of the beds at Valley Regional being filled up with patients who needed long-term care placement. So again, the wonderment is locally that, yes, we will here in time get 21 additional beds, but the fact that there is a moratorium on even the development, for example, of other additional nursing home places in our area, and in relation to the demographic of the Valley, I just wonder if we still are, really going to have a very, very short-term relief, if any, with those new additional beds, because we're not really providing the long-term care spaces that we need. And I know that there's currently certainly a couple of possibilities and proposals for some long-term care, sort of a small community-based facilities. And I'm just wondering if that is one of the options that is being explored by the ministry or by the District Health Authority.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman, and thank the honourable member for his question. Indeed, the moratorium referenced by the honourable member was something that was in effect. We're in a position now where we're doing the province-wide consultation. I made reference to it just a little while ago, and that is a province-wide consultation on continuing care. I anticipate receiving an interim report on that process in the fall, with a final report coming in the spring. The report that I'll receive in the fall will assist us in terms of looking at directions that we can take in terms of the provision of long-term care beds in the province. It's not just a question of number, but it's also a question of the appropriate location of those beds that needs to be addressed. In addition, the consultation is dealing with the issue of other levels of care, whether they be restorative care. We're taking steps to address restorative care in the budget with 50 new beds over a period of 2 years. Whether it is an enhancement of the self-direct, self-managed home care, which is addressed in the budget, not in any finalized way, but because we anticipate getting further recommendations from the province-wide consultation. Or the more traditional long-term care, or whether indeed there are other models that might be considered. And one of the, I know that there is some imaginative thinking taking place with respect to the nature of facilities that are being built, rather than looking at purely a long-term care facility. That the thinking now is that it might be possible to provide a broader spectrum of accommodation for seniors, so that it's possible for seniors to establish themselves in a location, and as the need arises, move from from independent living to assisted living to residential care type of assistance to the long-term care type of assistance, with the emphasis being placed on keeping individuals within their home for as long as possible. That is that's the sort of information that we want to get from the consultation process. And as a result of that, we will be able to hopefully make much more informed decisions than currently would be the case. While that is taking place, we also recognize that we can provide additional beds in areas where the demand is obvious, and the motivation there obviously is not just to provide the beds for those who need the long-term care, but it is also to free up acute care beds, which the honourable member references, and that the emphasis on alternate forms of care, i.e. home care, and other forms of care that may be identified, and the provision of additional long-term care beds will assist greatly in keeping people out of acute care facilities so that they can be available to those who need the acute care facilities. And the honourable member quite correctly points out that the demand is there with respect to acute care facilities, but hopefully if we can successfully put in place the spectrum of alternate care to acute care, then we can keep the demand for those facilities at an appropriate level and dedicate it to people who need that level of care. For example, the new Cobequid home will even have short-term acute beds and lots of community outreach in that facility. That's the additional 100 to 150 beds that we'll be looking at in the Sackville area. So that's the spectrum that I was referencing in terms of services that are available. And what we want to do is to prevent unnecessary ambulance trips from these facilities to traditional acute care facilities. So I very much share the concern of the honourable member. I hope that I've shared with him also some of the approaches that we have in mind with respect to addressing that in the long term.
Thank you, Minister. The honourable member for Kings West.
Thank you, Mr. Chair, and thank the Minister for that overview, certainly pointing a number of possibilities for still a major concern in our area as to the directions that will adequately address a very rapidly growing aged population in our area. So I thank the Minister for that. One of the areas that certainly the Valley, and in particular the Middleton area, has demonstrated a good degree of expertise and have developed some very important educational strategies around, and that is autism. Certainly the elementary school in Annapolis East has distinguished itself with a learning model for those children, which has made it in fact a center that has been attracting people from not only different parts of the province, but also military personnel to ask for a posting to Greenwood because of the outstanding work being done there. I know currently, and certainly appreciate the work of government to look at the IBI treatment that is now going to be coming on stream once some of the education and so forth is done. In speaking with Tom McNeil from Mental Health at Soldiers Memorial, I know that he is certainly pushing for something in that area to complement the work that's already been done. And I'm just wondering if the Minister is closing in on the point where you can actually talk about the location of a centre and what kind of time frame for the delivery of that service may indeed be. I know families are getting very anxious. I've been in correspondence with a couple of families who in fact decided this year to actually remortgage homes so that they could hire a private educational therapist to deal with their child who was 3 and 3.5 years of age. So the community as a whole is very anxious to get this program on stream, and I'm just wondering if the Minister could comment on timeline, possible location of where a centre may be.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman, and I thank the honourable member for his question, because he certainly touches on a topic that has received a considerable amount of my attention over the past period of time. And my obvious philosophy is that with the intensive behavioral intervention approach, the sooner we can get treatment to these children, then the better off we are in the long term. We will greatly enhance their lives and quality of life, and by starting the work very early in their lives, we can achieve much more than is the case if we're only doing it at the school level and beyond. Now, in terms of locations, there will be multi-locations throughout the province with respect to the delivery of this service. The delivery of the service will be through the district health authorities. They will be, the funding will flow to them. Currently, the challenge and what we are working on is to provide the level of training that is required to deliver IBI, and it does require a considerable amount of training. The good news is that as the training takes place, then the children are being treated, because you need the children to work with in order for that training to take place. So the professional that's providing the training to the other individual is there working with the children in conjunction with the person who is being trained. Now, obviously we have 2 individuals or 3, whatever, or 4, whatever the case may be, tied up in the provision of a service to an individual. After time, one student or that one child that is being addressed through the training process, the capacity will increase to 2 or 3 or 4 individuals, children that can be provided with that service. So it's very much something that will grow over time as we put in place the pool of trained individuals with the capacity to provide this service. And that is our objective, that throughout the province we will have individuals with the capacity to provide this service for autism. Some of these people may be people who are involved in intervention, early intervention in other facets of challenges that children have, so that they may not be, it may not be just autism that they're working with, but they will be individuals who have other training who will have the capacity to provide services to children with autism in circumstances where it may not be appropriate to have that person doing just autism, because the number of children that would require the service is so small that that you would be using that individual's talents or wasting the talents while the individual traveled from location to location. So we're looking at not just individuals who are trained in the provision of autism, but we hopefully will be taking individuals who have the capacity to provide other forms of early intervention and give them the skills to treat autism as well. So it is a process. The training is the emphasis in the early stage of the process, and as that training takes place, the pool of individuals with the skills to treat autism will be growing in the province, and over a period of a couple of years, we hope to have a fully functional program available to the children with autism in Nova Scotia.
Thank you. The honourable member for Kings West.
I didn't quite get there with that question, but it's one that I'm sure hopefully there will be some announcements forthcoming here, because I know the urgency of getting this particular program up to speed. So hopefully we'll be hearing some further good news shortly. One of the areas that certainly has been a bit of a constant in the year and a half or so since I've been in office has been around home care. And I guess I would have to note that perhaps we're making some progress here, but I do still get calls in that regard. And one of the areas that again is most often registered in my office is the fact that people who need it, of course, and have a family member that are anticipating the home care delivery at a certain time of the day, are not always getting it in relation to the appointment time that has been established. And if you take a look at the geography of the riding that I represent, and if you have somebody who a nurse is going to call upon at 9 o'clock, and at 9:30 are supposed to have an appointment in East Dalhousie. Well, that's not quite possible, and especially with the condition of the Aylesford Road, I may add. But in other words, the coordination of the home care seems to be certainly one of the big issues, and one of the calls that I hear from a whole lot of sectors is that if it were delivered by the District Health Authority, as opposed to the centralized program now that we have to deliver the service, in fact, we may be able to overcome some of those pitfalls. And again, I'm wondering, is there a determination to, in fact, have it delivered through the District Health Authority, and is there a timeline around that?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman, and I thank the honourable member for his question. We do anticipate that we will be in a position to hand off to the district health authorities in the future. What we're currently doing is restructuring the continuing care branch in such a way that the delivery model will be structured under the boundaries of the district health authorities, so that and we're going to deliver our services with a structure centered around that type of organization, so that when the time comes for the handoff, all of that reorganization work will be complete, and it is not something that the district health authorities will have to involve themselves with. And the part of the reason that we want to do this, as the honourable member points out, with the service being delivered through the model of district health authorities as opposed to the current one of divisions, we feel that we can get a much more efficient employment of personnel relative to providing of the home care service. So we're not quite where the honourable member wants us to be, but we're preparing the road to get there.
Thank you, Minister. The honourable member for Kings West.
Certainly, one of the services that we do have in our area, and I think probably can speak right across the province, is an outstanding ambulance service. However, again, this is a very localized question, since we do have the service operating out of Middleton, and I have the document in my office that I guess was handed to me by some of the local people who work for the ambulance service, studies that have been done looking at the nature of calls in our area. And one of the areas of concern is the fact of the extremely large